Hello, my name is Claude. I have a Bachelor of Science degree in nursing, and today we'll be talking about the impact of osteoporosis, osteoarthritis, and Parkinson's disease. And this project is being sponsored by the African Maranatha Mission based in Vancouver. So the overview will look at the three different illnesses or diseases: osteoporosis, osteoarthritis, Parkinson's disease. And for each disease, we will define and look at how it impacts people's lives and how they can be managed. So osteoporosis, it is a bone disease, and this occurs when the body loses too much of its bone density. Um, and when that happens, it makes it too little or too brittle. So the bones become weak, and they're very um, easy to break when they're subjected to pressure. As you can see on the screen here on the picture, there's a normal bone which has like a honeycomb or like a sponge-like um, look under the microscope, whereas on the other hand, the sponge-like, the normal bone is not there anymore. So you're starting to lose most of the density, and hence you can see there's like big holes in the picture. And some people describe their bones as brittle or they're thinning and things like that. Um, there are some health conditions such as multiple sclerosis, cancers, and the use of steroids medications, which also impact, which can cause osteoporosis. Um, and the risk factors include, as I mentioned, age over the age of 45, insufficient body mass, decreased growth, and genetic susceptibility, and living an inactive lifestyle. Um, and when you have osteoporosis, you are prone to having hip fractures, any sort of like fractures or to any bone. Um, so some signs and symptoms for osteoporosis. It is often painless, and hence sometimes people call it as a silent disease. However, some of the following symptoms can be noticed, and that include decreased height, change in posture, bone fractures, shortness of breath, and this usually results from discompression. And so when that happens, the diaphragm, the muscle that is responsible for breathing, isn't fully allowing the lungs to expand. So because of that, you get short of breath and pain in the lower back. Mhm. And then the impact of osteoporosis, there is increased risk for falls due to impaired balance and reduced bone strength. So when you have osteoporosis, you are losing the bone density. And because you're losing the bone density, those bones are becoming very weak and brittle. So you are prone to falling. And when that happens, uh, injuries can happen. And because of the decreased density in your bone mass, your balance becomes impaired and your bone is reduced in terms of like its strength. Um, there's increased mortality rate from surgical complications of hip fractures seen in osteoporosis. So if our elderly people like fall because of their fragile bones or because of impaired balance, they probably will need surgery if the sustained injury is too critical. And so one of the examples is hip fractures, and things like complications can happen, and one of them could be death. And then we see increased hospitalization because of falls in our elderly people. There's a decreased quality of life, and this is expressed or seen in those who experience depression, anxiety, low self-esteem, and loss of sense of independence because of the disease. Now, how do we prevent or manage or treat osteoporosis? Now, some preventive measures against osteoporosis, you want to reduce alcohol intake. You also want to exercise regularly. So any exercise that will help strengthen your muscles and maintain good bone health. You also want to try to lose some weight if you have a little bit more, if you are a little overweight. And what that does is, if you are overweight and you have osteoporosis, the more body mass you have, it will put pressure on the weak, brittle bones that you already have. So trying to lose weight would help to reduce the body mass onto your bones and avoid injuries. Some treatment for osteoporosis. We see the use of drugs called the drugs that help prevent deterioration of the bone while also activating bone growth. And these are Fosamax or Alendronate, Boniva, Actonel, Vista. And then the use of the supplement of calcium and vitamin D. We give calcium and vitamin D together because vitamin D helps in the absorption of calcium in the stomach. And as you can see on the picture here, we've got some food or diet that is rich in calcium that can help in maintaining good bone strength. And that is osteoporosis. Now, I mentioned that osteoporosis is the disease of the bone, disease of the bones. And then osteoarthritis, on the other hand, is the disease of the joint. Arthritis means inflammation of the joint. Now, if you take a look on the picture on the left side, there's a normal knee and a knee that is osteoarthritic. That is a joint that has osteoarthritis. Now, in the left picture, it says normal knee. You can see the white patchy cartilage in between the bones. And what that helps is it helps the joint move smoothly and avoid any rubbing against each other. But with osteoarthritis, the cartilage that you see in here is worn off, and now the bones are having to rub against each other, and that is painful and that is uncomfortable. So the cartilage is a firm rubbery material that reduces friction in the body joint and serves as a shock absorber. So osteoarthritis, by definition, is a degenerative or wear and tear disease that causes the cartilage in a joint to become stiff or lose its elasticity. So when the cartilage wears and tears, structures such as ligament and tendons, they stretch, which causes pain. And when the cartilage is worn off, the bones start rubbing against each other, which causes friction, which causes pain. And so some signs and symptoms of osteoarthritis are joint stiffness, joint aches and soreness, especially after movement, and you get this decreased range of motion because you don't want to overextend your joint, and then you see joint swelling and tenderness. Um, and the picture on the right side here gives um, all the symptoms that we see. Now, how do we treat osteoarthritis? Um, there is no cure for osteoarthritis, but these methods here help manage osteoarthritis. So physical therapy, so muscle strengthening exercise such as walking, swimming. You also want to apply heat or cold compresses to the affected joint. That differs from people. Some people will like prefer cold compresses, or the other person would prefer hot compress to help alleviate pain. And then we see joint fluid removal to alleviate inflammation. So when the joint swells, usually it's the synovial fluid, a type of fluid that helps uh, the the cartilage, the ligament, the tendons to not like rub against each other. It's sort of like it's a friction fluid. It helps remove friction in the joint. So when there's an inflammation, that fluid builds up, and so in case of arthritis, they can remove the fluid to help alleviate the inflammation. And then there is medication administration for pain that you can use, Tylenol, Advil, naproxen, whichever one you desire. And then there's use of supportive devices such as crutches or canes to help as well with mobility. And then surgery can be done, such as arthroscopy and some other joint replacement surgeries. And then at home, what can you do to help manage your osteoarthritis? You can use braces, splints, canes, or shoe inserts to help keep direct pressure off your joint. But with that, you want to speak with your healthcare provider for recommendations, or physical therapist or occupational therapist for that. You also want to avoid bending and lifting of heavy objects, as this causes more pressure to the knees and other joint. The more pressure you exert on your joint, the more pain you feel. You also want to position pillows to support your back and neck, or wherever you're feeling stiff or pain. You also want to determine which of the compresses work best for you, either if it's heat or cold or both. Um, Eat a balanced diet such as fruit and vegetables, diet that is low in fat, dairy, and whole grains. You want to try to lose some weight. As I mentioned earlier, overweight adds strain and pressure on your joint. And so the more strain and pressure you are exerting on your joints, the more pain you feel. So losing some weight will help reduce the arthritic pain in affected joint. And then the third disease that we'll be talking about is Parkinson's. And Parkinson's is not a bone or joint disease, but rather a neurodegenerative disorder that affects movement. So Parkinson's occurs when your nerve cells, or what we call neurons, in the area of the brain that controls movement are damaged or die. So when the cells of the brain in the area of your brain that controls movement are damaged, your balance is impaired. So those neurons that I was mentioning that control that are in your brain area that controls movement, when those neurons are responsible for producing dopamine, and this dopamine is a chemical that is responsible for movement and coordination. So the more neurons you lose, the less dopamine is produced. And because dopamine is responsible for movement and coordination, so the less dopamine you get, the more imbalanced you become. Your movement becomes imbalanced. Your coordination is no longer in good, tight condition. As you can see here, there is a picture depicting, you see the green dots in the upper left corner. There's a lot of green dots, and those are supposed to symbolize dopamine between the neurotrans and the neurons. And then just below that picture is like the neurons with like just 5 small green dots, showing how less of the neurons you have when you're how less of the dopamine you have when your dopamine is not being fully produced, or when your neurons are affected. And so when that happens, your movement and coordination are impaired. So you start to experience speed changes, tremors, slowed movement. We'll talk more into symptoms like on the next slide. Okay, so when the dopamine is not produced in normal quantity because the neurons have been damaged or have been impaired, you experience tremor in your hands, arms, and legs, jaw, or head. You start moving slowly. We mentioned how it affects movement. So slowed movement, that is known medically as bradykinesia. Your muscles become rigid. There's change in speech patterns because your jaws, you probably won't be able to articulate speech quite fluently. And then your posture and balance become impaired. You can see some people like having like a leaning forward posture, is not known as like stooped posture. You experience difficulty swallowing, chewing, and speaking. That's because all your muscles and bones like along the digestive tract is being affected by the neurons. And so some of the picture here kind of gives a detailed signs and symptoms for Parkinson's disease. Rolling tremors, shuffling or propulsive gait, depression, possible mental deterioration, difficulty initiating movement, loss of ability to swallow, decreased blinking of the eyelids, and stuff like that. And treatment for Parkinson's, there's no cure for Parkinson's, and treatment is based on symptom management. And so some of the medications that your doctor may prescribe include carbidopa, levodopa. And so this drug mimics the dopamine effect. So once the drug is administered and passes into the brain, it is converted into dopamine. Dopamine is the chemical we said that is responsible for movement and coordination. And it's given carbidopa and levodopa because carbidopa helps the levodopa to not be absorbed outside of the brain. So it has to get into the brain to produce its effect. And then there's a classification of some medications called monoamine oxidase inhibitors. And these drugs help prevent the breakdown of brain dopamine by inhibiting the enzyme on amine oxidase B, which is responsible for dopamine breakdown. And then there's amantadine, and then people can surgical procedure, and then surgical procedures such as deep brain stimulation can also be used to help stop the movement related to symptoms of Parkinson's. And so all these three diseases, Parkinson's, osteoarthritis, and osteoporosis, they all put our elderly people into false risk. So it is very critical that we prevent falls at all costs in our homes or wherever we are. So in our homes, you want to maintain a clean environment where there are no clutters or wires to trip on. You want to remove all tripping hazards in the home, no slippery throw rags or loose carpets. You want to install grab bars or handrails. You want to maintain a well-lit environment so our elderly can see clearly where they are going. Wearing of hip protection to minimize injuries when falls occur. Wearing of socks with grip to prevent sliding and tripping accident, and wearing head protection. Now, all these three different diseases are chronic and require ongoing healthcare of some sort management, whether it's physio, access to pharmacy for refills, and other needs. But with COVID, that all was affected. So COVID putting more strain on how many times the physio is going to come into the home, or COVID preventing some of the activities that are needing close contact. Um, and so all this impact of COVID, there's already impact that the diseases are causing or affecting our elderly. And then with COVID, it adds even more stress on how the management of the disease is being taken care of. Um, and that is all the presentation for today. Thank you for your time. I hope you find it helpful.